Welcome back. This morning we are tackling something most of us have probably experienced before, acne. So here to walk us through the causes and how to treat those pesky breakouts is Dr. Amy Wechsler, who is a board-certified dermatologist and also board-certified in psychiatry, too. She just opened Spotless. It's a clinic here in New York City that specifically treats acne. Good morning.
Good morning.
Welcome.
Thanks for having me.
So let's start off with the definition. What exactly is acne?
Acne looks different in different people. There are blackheads and whiteheads, which most people are familiar with. They're smaller, but then there can be those deep cysts that are painful, often down here in the lower face, especially in women.
Okay.
You know, we often associate it with teenagers, but it doesn't always have to be teenagers who have an acne breakout.
No, 90% of them have it, but still 80% of 20-somethings and 50% of 30 and older. Really common also around perimenopause.
So, Amy, what causes acne and what causes its severity in folks?
So there are a few things that cause acne. The main one is genetics. And I always say we can't fight our genes, but also hormones and stress, sometimes products, also sports equipment like helmets and pads.
Right.
So I think you asked a really good question before we went on. Like, is there a certain age at which kids should start to treat it or use products that can help?
So little kids, we don't really wash their face, right? We just use water in the bath. But pre-puberty is when the oil glands turn on and little blackheads and whiteheads start to form in the T-zone, sort of like the forehead and the middle of the face. And then we should start teaching them about cleansing or washing their face with a gentle cleanser, moisturizing with what's called a non-comedogenic moisturizer, which is like a big word that means won't clog your pores and cause pimples.
What about some of these other items on the screen as well? What are some of these products?
So these are salicylic acid and benzoyl peroxide are over the counter, so anyone can get them in a pharmacy. Also Differin gel, which is kind of the strongest over-the-counter product. Start with those if you have pimples, but I always say don't do more than 2 because it can really irritate your skin. And if you're still breaking out, then you need to seek some medical help.
What about toothpaste? Sometimes I'll just put toothpaste on a breakout, and it seems to work.
It's an old-fashioned treatment. It usually just dries the skin up around it, and often the pimple stays behind. But if it works for you, like, fine.
But your pimple has fewer cavities.
Exactly.
Oil-free products generally also the
Yes,
best idea?
non-comedogenic and oil-free are essentially synonyms.
I've always wondered about that. So, like, if it, like I have a 16-year-old now, right? So I try to give him some product that I found. But then I'm like, do you still use moisturizer afterwards?
Yes, and people with acne are scared to use moisturizer.
Yeah, I was scared to give him moisturizer. Yeah,
Of course.
Should you not?
No, you should, but it has to be that non-comedogenic kind. So you're not making it worse. And a lot of the acne treatments dry the skin out. And if you don't moisturize, the acne can actually get worse.
And I think they're afraid by using, and I know a lot of teenagers are, they're afraid, and adults, to put moisturizer on because they're afraid it'll make it worse.
Right, but the right one will not.
Okay.
Yeah.
You're also certified in psychiatry.
Yes.
I feel like when I break out, I'm like, what is going on with my life that I'm stressed out? Is there anything you can do for those, like, stress breakouts?
First, just acknowledge it, right? Figure it out. Oh, okay, I didn't sleep a lot the last few days, or I had an exam, or there's something really stressful going on in my life. That's what's going on. And then try to break the stress cycle if you can. Get outside for a little fresh air, connect with a friend in person, do some deep breathing exercises. Whatever it works for you.
And that could actually work with your skin?
It does help, but also know that when the stress is over, hopefully it's not long and chronic, the acne will get better too.
You know, full disclosure, Amy and I, our daughters went to school together.
Oh.
And in fact, you're a child psychiatrist and noticed that there was so much of a feeling of self-worth or whatever as when kids had acne that you actually moved into skincare.
Wow.
That's right.
Really?
Exactly. So I had patients in psychiatry who had faces and bodies covered in acne, and that was bothering them more sometimes than their mental illness. Of course, we need to treat both. And I thought, ooh, there's such a big connection there. And then I went back and trained in dermatology. And
How do you decide, like, I mean, I guess teenage breakouts especially, that's one thing. How do you know when to go to a clinic like yours?
I think once you try an over-the-counter product, or 1 or 2, a couple of times for a few weeks. If it doesn't work, come in. The thing about Spotless is you don't even need an appointment. You can just walk in.
Oh.
It's hard to make an appointment with me and with other dermatologists. There aren't that many of us.
It takes a long
We're
time.
busy. We're only open 9 to 5. Spotless is open till 8 during the week. We're open on Saturdays. You can just walk in, and the clinicians have all been trained by me in how to take care of acne really well.
That's so great.
Thanks, Dr.
Thank you so much.
You're welcome. Thanks for having me.